got their hand raised already. I can make a difference.
All right, Dr. K, you are a second. You're live, Dr. K.
Good evening, everyone. I am Karen Johnson, the lead pastor here at First Christian Community Church, and I would like to welcome all of you who are online here today. Just want to invite you just to come on into this conversation. Tonight is a special edition of our Wednesday night chat, and I would like to share with you that if you are following us here on Facebook Live, please hit that like button and share out and start as many watch parties as you can. Our panelists tonight will be sharing important information about the COVID-19 vaccine, and we want to reach as many people as possible. We also would like to welcome those of you who are viewing us through our YouTube channel and those who are on Zoom. We will be accepting questions during this discussion. So if you are here on Facebook Live, you may put your questions in the comment section. If you are on Zoom, look over at the bottom of your screen, or maybe at the top, and you see a Q&A. You may put your questions over in the Q&A. Also for YouTube, your questions can also go in the comments. So we will definitely be having someone who will be looking over all three of the platforms to make sure that all of your questions will be answered tonight. So again, share this out to as many as you can, and give us some likes, because we want to get this information out to our community. So again, welcome everybody for tonight's conversation. And I would like to introduce to you our esteemed panelists, some fine ladies who have come together tonight to share some information and to help enlighten us. So I would like to introduce Crystal Coldiron. If you could raise your hand, Crystal Coldiron. She's the Director of Assessment and Planning with our county, Anne Arundel County's Health Department. Welcome, Crystal. Thank you so much for coming here tonight. We're really glad you could be here. We also have Jean Mary. Jean Mary is the Director of Infection Prevention and Epidemiology. She's also from Anne Arundel Medical Center. Welcome, Jean. Thank you again. And the next three ladies I'm going to introduce to you, all of you already know them. They're from First Christian. They're part of our health team squad, and so they are here tonight as well. We have Ms. Ferkerta Forster. She is a family nurse practitioner. We have Anne Marie Holland, who is a clinical educational specialist at the medical center. And we also have Irma Holland, who is a director of clinical education and professional development at our medical center. Welcome, ladies. Welcome again. Thank you so much for coming here tonight. I know as far as Anne Marie and Irma, you two were definitely instrumental in putting this together. So again, thank you for the time that you put in so that we can get some good information out to our community so we can make some good decisions regarding this vaccine. So tonight in this discussion about the COVID-19 vaccine, the underlying core or the objective is to address the major distrust in our Black and Brown communities about the safety of this vaccine. It speaks volumes that African Americans are dying disproportionately at a disproportionately higher rate across this nation. Yet in light of that, we are the most hesitant about taking the vaccine. And our skepticism is real because it's rooted in three historical facts, and that is the Tuskegee syphilis study, the issue that happened with the Henrietta Lacks cells that were taken from her and was not done with her permission or her family's permission. And so that was a big issue. And also from a Dr. James Sims, who is considered to be the father of modern gynecology, who conducted experiments and surgeries on enslaved Black women. And he did so because he felt that Black people didn't feel pain. So it is with this historical backdrop, coupled with the everyday institutionalized racial disparities in our medical center system, that has brought us to this crossroad, this indecisiveness, this hesitancy or skepticism, if you will, of do I take the vaccine? Do I not take the vaccine? Or I'm going to sit back and see how other people fare with the vaccine, and then I will decide. And it's for this reason that we have brought together trusted and familiar medical professionals who can provide us with some solid information so that we can make a good decision based off of good information and not misinformation and myths about this vaccine, right? So as we kick off, I'm going to direct our first question to Ms. Crystal Coldiron, and just wanted to update our listeners regarding the stats here in the county. It is noted on the county's website that our total cases are increasing, but new cases per day are decreasing. Can you explain that for us, please?
Absolutely, and thank you, Dr. Johnson, and to the F3 family for having me today. This is it's an understandable question. I'll show you the graph that our congregation member was asking about, but if you see the blue line here going up, that's our cumulative total cases. So imagine that you have a warehouse full of apples. Those will symbolize our cases. And every day you're adding to that, so the total is going to keep going up. But on Friday, you might add 5 apples. On Thursday, you might add 3 apples. And on Saturday, you might add only 1 apple. So while your cumulative total is still going up, your daily addition might be going down.
Okay. All right. All right. Thank you. Thank you. So next question that we have is regarding the new variants of the virus that's emerging. One is coming out of the UK, and if I recall, that was just identified maybe a week or so ago right here in the county. And then there's another variant from out of South Africa. Can you share with us, and this goes to either one of you ladies, how dangerous are the 2 strands, and have any cases of the South African strand been identified here in our county?
Well, I can say from the health department perspective, the Maryland Department of Health is testing samples every day, monitoring to see what strains have come into the state. As you mentioned, the UK has been found. But from a concern perspective, the severity does not seem to be that much different, but it does spread much more quickly to other people. So just to put that in perspective, only about 1% of our county has been infected with COVID. That's not including just people who have been tested. So we're not out of the clear yet. So for a strain to spread quickly to others, it's concerning to us, and we're definitely monitoring that closely.
Okay. All right. All right. So in akin to that question, since we're talking about the new variants, of course, I guess I should have started this question off, the first question, and that was, what causes viruses to mutate?
Hi, Dr. Johnson. I can speak to that a bit. So interestingly enough, viruses mutate over time and on a regular basis. It does that in a couple ways. One, it requires a host cell to reproduce. And sometimes what happens in that reproduction is that it makes errors or copies that have errors in them. So it changes the structure a little bit. The other way it mutates is as it tries to survive in our world and transmit, and it adjusts its composition or structure, it's looking for ways to maintain itself. So it will, as it interacts with our bodies and the antibodies or vaccine antibodies, it will try to modify itself because the goal in the end is for it to survive. Now, some of these mutations can change it in a way. It can make it more infectious, similar to the UK strain, or it can make it less infectious. So it's something that, one, is expected. We see it every year in the flu virus, and why every year we have to tweak that flu vaccine concoction to adjust for those mutations. And so I think the message here is it's not unexpected. We knew that this would be happening. And the scientists in the world are kind of watching where this goes, and time will tell where those mutations are going to take us.
Okay, all right, thank you, thank you. So with this new strand that's out here, what is there anything else that we need to do, you know, in conjunction with the current protocol that's in place, and that is, you know, wearing your mask, social distancing, and frequent hand washing? Is there anything else that we need to be doing?
Well, I think one of the reasons we're here tonight is to talk about one of the major steps that we can take, and that's in vaccinations. So when we're combating new viruses like this, obviously your infection prevention protocols with the masking, hand hygiene, the isolation and quarantine, as we've learned, that has an impact, but it hasn't stopped the spread of the virus. And vaccines are that extra arm of this fight against the virus, and plays a major role in this, because if we can get enough people vaccinated, we can reduce that transmission and actually protect those other folks that can't be vaccinated. So if you have a loved one at home that can't receive the vaccine for any reason, but you can vaccinate the family members around that individual, it does provide kind of this level of protection, almost like a football term, a defensive line, kind of blocking that virus from getting in. I do think with us watching this variant process, it's a good time to do a reset and reevaluate. Are we wearing the correct mask? Does it fit properly? Are we still doing the level of hand hygiene that we need to, and the disinfection that we need to? But it's going to be, this vaccination piece is going to be huge in the fight against this virus and actually stopping the pandemic.
And you're right, that is the main reason for this conversation, because that is the hurdle that we have to get over, and that is getting enough information to people regarding the safety of the vaccine, so that, you know, we can put an end to this thing, or at least draw it in. You brought up about the mask, and I'm just going to throw this over to Anne Marie, and that is, we've been seeing lately where it's sharing that we need to double up, I believe, our mask wearing. Can we talk about that real quickly, please? You're on mute.
I think that is interesting. And I think I'm looking at Jean, because I look at what we do at Anne Arundel Medical Center as far as doubling up. And I think it's the level of protection that the mask is giving. So for an example, because we're in the organization, like, we're not even allowed to wear the cloth mask, because a lot of them don't even give you any protection at all. So I know they're cute and they're pretty and stuff, but if you're in the organization, you have to have on at least a level 3 protection, like hospital grade mask. So we do wear those. A lot of our staff who has an N95 on, they will definitely wear another, like a level 3 over top of it, just because a lot of people just, I don't know if they just don't like the N95s, but they will double up. But I haven't heard, I heard the the governor say that. So Jean can probably say, because I know the governor's saying a whole lot of things.
Yes.
Like Crystal said earlier,
Yeah.
that yeah. So so Jean, our infection control specialist, can probably say whether we really need to double up yet.
Yeah, thank you, Anne Marie. And this actually came out of an interview with Dr. Fauci, and he was kind of asked the question, is it safer to put an extra mask on? Will you be safer? And he said, yeah, sure. That has kind of snowballed in a way and has grown a bit. I think what's the most important fact here is you need to evaluate, even if you are wearing a cloth mask, not every cloth mask is equal. And you have to be very selective of the type of mask. I think it's far more important that the mask fits properly. And I'm sure you've seen those folks that are wearing masks that are hanging down below their nose and the ear loops are all stretched out and they're just kind of hanging there. That is not providing a level of protection that individuals need. You do want a mask that has 3 layers, and the type of material that the mask is made of is so important. The tighter the knit of the fabric, the better. I have seen some products out there. They're really comfortable. They're nice and stretchy. You don't want a mask that is stretchy because as those fibers pull apart, it actually opens the mask and makes it really easy to breathe. And there's a reason for it, because the resistance and the layers or the fabrics is opened up so more air can travel in between. There are some medical masks that are available through like a pharmacy and things along those lines. They tend to be expensive. But I would believe that it's far more important to get a well-fitting, well-manufactured mask and make sure that you launder that mask daily. Because just understand, you do have bacteria in your mouth, and as you breathe and that air gets filtered through, you're collecting the bacteria in that mask, and you want to kind of wash it. And it just needs to be soap and warm water, and then you let it air dry. And making sure that it fits along your nose bridge and then under your chin. You should not have any gaps along the sides or too large of gap, because then when you breathe in, the air channels around the fabric and in through those gaps. So definitely, now we are waiting to see what the CDC does with this. They have not made a recommendation to change the recommendation at this time. So I do believe it's a kind of a nice reset to reevaluate what mask you're wearing. And if you can lift it up and see light coming through, that's probably the time that you need to get rid of that mask and get a new one.
So the challenge for some in the community would be the affordability of the mask, because they're not necessarily cheap. So the disposable mask, the blue disposable mask that we see, is doubling that beneficial or what?
You can, the medical looking masks that are disposable, those really need to be thrown away daily.
Right.
The reason for kind of an over mask is, say for instance, you do have a cloth mask that's just not a grade that's going to filter well. You can put another mask over top to help to protect the front of that mask. But the disposable can get pretty expensive, especially if you're throwing them away every day. You could wear a cloth mask and then one of those medical masks over top and then dispose of that, daily. But again, I think the key here is finding a mask that either has a cloth mask that has at least 3 layers to help better filter, and then the fit is going to be critical.
We just had a question to come in. And so the question was, so the virus is airborne, correct?
Well, its primary method of transmission is actually droplet. And I think airborne and droplet kind of get confused in a bit.
Okay.
Droplet transmission is the primary means that this virus transmit, and then contact as well. Droplet means the virus is contained in the droplets as you talk. They're very heavy. They do hang in the air, but then they'll settle on surfaces, and then you can pick that virus up by touching objects that could be contaminated. There are certain situations where the virus could be airborne. And what that means is that the virus is contained in a smaller size respiratory particle, and it tends to hang in the air for a long period of time. We see that much more in the medical setting, where we're artificially doing something to the airway, whether putting a breathing tube in, giving a respiratory treatment, things along those lines. So for the most part, I think it is rare that it is airborne in a community setting, but it can happen. And so all the more reason for that masking to occur when you're with other individuals out grocery shopping, things along those lines.
Okay, so okay, what you just said there, airborne is different from the droplet.
Droplet, yes,
Okay.
yes, ma'am.
All right, so you're right, because that's been a big confusion. So I just want to do a repeat to make sure we got it, because so to be airborne is smaller particles, and it just remain in the air for a longer period of time. That's what makes it airborne.
Mm-hmm.
Particle droplets, it can hang, but then it can rest on surfaces.
Correct.
Okay.
Yeah.
So here's the next question. We're seeing less use of gloves. So do we need to wear gloves, or we don't need to wear gloves? And
Oh, go ahead.
Yeah, and do we still need to be Lysoling the packages that come in from the mail? And Lysoling the UPS.
Here's where we can save you money. You do not need to wear gloves. Hand hygiene. What happens when people wear gloves? What are they not doing? They're not doing their hand hygiene, right? And that is what it kills the virus. So the alcohol-based hand sanitizer or even soap and water will kill the virus. So when people are putting layers over, they're still transmitting the virus with their gloves. And sometimes they mistakenly assume that that's not going to pick up the virus, and they end up not washing their hands as frequently as they would if they were not wearing gloves. So we actually, in the hospital, we don't wear gloves outside of patient rooms, even handling certain equipment, things along those lines, because we know that hand hygiene will remove that virus from our hands.
All right, good. We do have some questions again regarding the mask. And the question is, should people that are not in the medical field be trained on using the N95 mask? Which one of you ladies want to take that, for Kurt or Irma?
Mike can handle that one. I would say no. Because when our medical professionals within the hospital who are using the N95 mask have to go to someone in employee health or some other trained professional who do what we call a fit test. So they put them in a little hood and they spray different scents around them, different things around them, make sure that the fit is good. They want to make sure that none of that particle can come through the mask. And nobody in the community, we have people who have to be trained to do that, to fit test everyone who wears an N95. So even within the hospital, like say if we have students coming in, and that's a huge group, if we have 1,000 students coming in, we're not going to necessarily fit test each and every one of those students. What we're going to do is to prevent them from going into rooms where there may be airborne particles, because the N95 is more particular for airborne. We've been using N95s in the hospital forever, well, long time, since I've been in the hospital anyway, which is forever. But we've been, those are used for any type of air. This is not the first thing, this is not even as airborne, what we would consider airborne. So we've been using the N95 in the hospital for years. We've always had to fit test each and every one of our employees who will be wearing it. So I would say it is not something that you would want to see in the community. And just one thing, I see a lot of people with N95 looking masks, but that doesn't mean they're N95 mask, because that's the difference in the density of the materials that it's made out of.
Quick question. So how long do you think we're gonna be wearing these masks? For Curtis?
Thank you for asking. Yes, I think at least through September. At least through September. I mean, we're going to get vaccinated. The vaccination is going to increase by April, hopefully. But I think we're going to wear the mask through at least September. Pandemics usually last about 18 months.
Do you think that it will be one of those, you know how life's changed after 9/11? So do you think mask wearing for certain professions maybe may continue?
Yes. I do. I think not just certain professions. I think it's probably going to be a world thing for a while. It's going to be like that for a long time.
All right, good. So there was one more question again about the mask, and then we're going to get on with the vaccine. It says, is that mask available and where? Which one are we talking about?
I think it's
Oh, okay. We think the person is talking about the N95. They're not, N95 is not for us, okay? That's not ours. All right. Okay, so, it says, what about when trying to purchase correct mask? Can you get that question for us? It's in the Q&A. What about when trying to purchase correct mask?
Oh.
While she's getting that question together, I'm going to go into the question regarding the vaccine. So here's a big thing. Folks are asking, how in the world did they get this vaccine developed so quickly? Okay, they want to know if it took years to get a vaccine, 4 years to get vaccine for the mumps, I think, or something like that. How in the world did we get this COVID-19 vaccine so quickly? Now, I know in the church, we pray for a quick discovery of the vaccine. So from a spiritual perspective, I think the Lord answered our prayers. However, we need to talk from a scientific perspective. So would you just talk to us? How did this happen so quickly? Which one of you ladies want to tackle that question? And in addition to that question, it is, what's in the vaccine? Is the virus in the vaccine, or what's in the thing? Which one of you want to take that question?
I can jump on that unless somebody else wants it. So so what happened? Let me describe what usually happens with the FDA.
Okay.
So drug companies in the past used to have to invest their own money into drug discovery, and what they would do, there were certain touch points that they would have to submit their data to the FDA, and the FDA would get around to it sometime of reviewing their data and then approving them to go on to the next step. Well, the drug company would not continue production until they got that FDA approval. So it was kind of this leapfrog approach, and it would take forever because we all know that sometimes things don't run very efficiently in the government. So what was different this time around is that, one, I want to just kind of touch base. A lot of the technology already pre-existed prior to this moment. And they had been working on this vaccine technology early on with the first SARS virus, when MERS-CoV happened. There was some development as well back in HIV, trying to find a vaccine. So what they lacked is the money. And so with some of the policies that were put in place, the government funded the research. And what happened is the FDA took away the red tape. And what they did is they did what we call a simultaneous approval. So as the drug company met the requirement, they kept going. And understand money was pushing that process down the line. And the FDA was simultaneously reviewing the outcomes. So when it came time to make the approval, the turnaround time was extremely quick. And so they started the vaccine trials in March, and there was no deviation from the requirements that the FDA put forth. They just became more efficient at getting the approval process started. And there was an investment of money. So that helped the whole process. And one will hope in the future, drug discovery happens in this same way. So we don't have to wait as long for new medications to come out.
Yeah, well, it sounds like it. You know, what you're just sharing, that some of these things were held up because of finances, and money is the thing that helped to push it through. Yeah, hopefully some other vaccines will become available now that we see it can be developed much quicker than we've been seeing historically. So that's interesting. And so, and again, so what you're sharing, it's not like the vaccine, this COVID-19 vaccine was developed from scratch. It was built upon vaccines that were already here, and they just did whatever they need to do, improve it. Okay.
Correct.
Thank
Yep.
you. All right.
Can I feedback off
Yes,
question
please.
that you had? And no, the vaccine does not contain the coronavirus itself. So it's impossible to get the vaccine and then contract coronavirus.
Good. Thank you for bringing that out. Now is, because I know the question is going to come up, so I'm going to ask it in advance. So many people think when they take the flu shot, they get the flu. Can you address that, please?
No, it's just an immune response that you get. And that's a good thing to receive, because that's saying that your body is reacting to the vaccine. So it's building up antibodies.
Great.
So it's actually a great thing.
All
and
right.
the COVID-19 vaccine does the same thing.
All right. So have all of you ladies got your shots, your first shot? All of you got your first shot? Anyone got the second shot yet? Oh, okay. So so how was it? How was the second go round? Do tell.
It's good. I got mine yesterday, and I'm here at work today. Just a sore arm, and that's it.
All right, Anne Marie.
Yes, I got my second one a week ago.
Okay.
And just had a little headache in my sore arm, but I'm still here. I don't have an extra arm or extra ear or extra me.
Irma.
I had my second today, and I expect I'll be fine. I'm fine now. But I had a pretty sore arm, like a tetanus shot the first time, and that's about it. So I'm expecting to fare well.
All right, very good. Furkert, have you had your second?
No, I haven't even had my first yet.
Oh, okay. All righty. All right. Okay, a question is, how long does the immunization last for this COVID-19 shot? So is it a one shot, we're good for life? Is it yearly, or do we know?
I'm not sure we know that information yet. I know there's a lot of theory and conjecture at this point. But it does, well, it depends on the type of COVID vaccine that you get. Moderna and Pfizer are a 2-dose shot. And one is 21 days apart, one's 28. What we do know is that the folks that were or received the vaccine in March are still demonstrating antibodies and protection up to this point. And I think as time goes by, we'll have a better idea, and they're going to be watching kind of those mutations that happen. The way this one was developed, which is different from every other vaccine, is that it's targeting a specific part of the virus. And that specific part of the virus is what's responsible for it kind of sticking to our cells and then injecting the virus into our cells to replicate. And so it's targeting that piece that does that, which is quite ingenious. And so basically it's giving us the ability to prevent the virus from replicating. So I think we'll know more information. Some of my colleagues may have gotten some updates that I haven't seen yet, but I think time will tell as we go forward.
All right. I want to jump back to the previous question. This is regarding the side effects of the vaccine. So you ladies here had a very mild to no side effect. But from the study was done, have there been noted any prolonged side effects? Anything been noted with the vaccine? I see you shaking your head for Carter.
Not that I know of. I just know that he was saying that if you're going to get any side effects, they usually happen within 15 minutes after receiving the vaccine, and which CDC is recommending that you stay there after getting the vaccine to be monitored for at least 15 minutes. And if you're going to have any serious effects, it's usually going to happen within 30 minutes to 30 minutes after getting the vaccine.
All right. Next question is, if you had COVID, should you still get the vaccine? If you've had COVID, should you still get the vaccine?
Yeah, you should still get the vaccine, but they're recommending that you get the vaccine 90 days after being diagnosed.
Got you. All right. So with that, along that same line, the next question was, if you had COVID and fully recovered, do you encourage donating your plasma? Is that being encouraged?
I can speak for the hospital, yes. We are still using some convalescent plasma for some of our more critically ill. So yes, we would love to have people donate their plasma. And I think that information is on our website in order to be able to do that.
Okay, all righty.
Just real quick, I do want to mention that you want to donate before you get the vaccine. Because there is some contraindication to donating plasma after you get the vaccine. So the key is to donate your plasma after you're ill and before you get your vaccine.
All right. This is jumping back, and I guess this may be a Crystal question. It's regarding the possibility of kids going back to school. Will vaccines be required for children, or number one, if it's available for children? If so, is it going to be required? That's the first question.
So first, the vaccine has not been approved for children under the age of 16 yet. So the vaccine is not available for children yet. And then about it being mandatory for children, teachers, or otherwise, since it was developed under emergency mandate, basically, at this time, none of the vaccines are recommended to be mandatory.
All right, all right. And this is another question. This is going back regarding children in school. This is going back to the mask. With respect to types of mask, is it safe and effective? How is it safe and effective? And how can we prepare our children to return to schools? I guess this is in reference to the mask again.
I read a good tip. I'm a mom too in Anne Arundel County. Before your kids start going back, getting them used to wearing the mask. So maybe an hour a day, and then eventually build it up to 2 hours a day just to get them used to it and not pulling it and touching it. So just doing some trial runs at home I think will be really helpful.
All right, good. All right, thank you. Question comes in. Should pregnant women take the vaccine?
The American College of Obstetrics and Gynecology state on their website that it should not be withheld. And what does that mean exactly? So there needs to be a discussion if you are pregnant, you want to have a discussion with your OBGYN.
Okay.
With regards to the benefits and the risks of receiving the vaccine. One thing that we do know is women that contract COVID during pregnancy are 3 times more likely to end up in the intensive care unit in severe distress as compared to their non-infected peers, other pregnant women. So that is kind of a personal discussion. We encourage you to speak with your OBGYN and really understand what those risks are. I will say we don't have a lot of literature with regards to the impact on pregnancy, and that's ongoing. They are starting a clinical trial with pregnant women, and so we'll know more information in the future. So I do know that folks that had participated in the previous trials, some women did get pregnant during the time frame, and they're carrying those children to date. So, but again, please reach out to your OBGYN, and I'm sure our nurse practitioner can add more detail to that.
I agree with the same thing that you said. You have to consult your OBGYN because it's not enough research for us to say whether it's okay for pregnant women to get.
So the person who's asking this question said that her OBGYN won't answer. Won't give them a yes or a no, just won't give them an answer. So what are they supposed to do?
I would get a second opinion.
Get an OBGYN.
Yeah, to have an open discussion.
Yeah, all right.
Yeah.
Thank you. The other question is, should elderly people wait before taking the vaccine to see how its effect on others? Should they wait a while to see how this plays out before taking the vaccine? Do you recommend they're going on taking it now, or should they wait? That's the question.
I think we're all shaking our head no.
Hold on, a handshake. I want somebody to mute that.
Actually, the elderly, we know that over the age of 75 is the highest risk age group of all of our individuals, even 65 and older, and then it goes down from there. And the reason that they were selected as one of the higher cohorts for receiving the vaccine, and we're already starting to vaccinate that age group, long-term care facilities. You are the people that this vaccine really is developed for, because you are at such risk. So we would not recommend waiting to see what happens, because in the interim, you could contract COVID And we know that's such a high risk and brings such high mortality for that age group.
All right. Very
Yeah.
good.
And also with the, I'm sorry to interrupt, but also with the age being included, you also want to look at all the comorbidities that the elderly had, such as the serious heart conditions. So they put them at even a higher risk. So we definitely recommend that the older.
But if I add an equity lens to that, so even though 29% of all of our deaths were over the age of 75 in our county, for African Americans, for our Black people listening here, it's important to understand that we're trending a little bit younger for deaths for COVID-19. So for African Americans, 65 to 74 is where we're seeing the higher death rate for African Americans. So as soon as you can, we advise that you pre-register for your vaccine to get notified as soon as your phase opens up to get vaccinated. So, but yes, as soon as you can, it's important to get on that pre-registration list and get vaccinated as soon as you can.
All right. So say that age again. That's 65 to what you're
The
seeing?
65 to 74 is higher in the African American community.
And for death rates.
Yes, as opposed to over 75.
Mm-hmm.
So in Anne Arundel County, the majority of our residents who are over the age of 75 are white.
Got you.
Mm-hmm.
All right. Do you know why we tend to be more, the death rate is higher for us?
Well, some of it is just previous health disparities. So our life expectancy is not as high as our white fellow community members. So that's part of some of that trend. And Jean, you know, as an epidemiologist, I know she has some insight into this as well, but that's part of it. Some of it's just actually demographics of those age groups.
All right. Okay, thank you for that. The next question, will my doctor recommend a particular vaccine based on my health or the one made available to them? I see head shaking again. Irma?
I believe that whatever is available is what you should try to get. And that's what your physicians will be doing also. Whatever is available will be an FDA approved vaccine, and that's what you should go for.
All right, thank you. All right, okay. What's the effectiveness and contraindications regarding reactions to chronic conditions? I need to repeat that. This is regarding chronic and pre-existing conditions. So I'll rephrase it. So I guess the person is saying, if I have chronic and pre-existing conditions, how would my body react to the vaccine? For Curtis, you're on mute.
I would say, I don't know as far as that question, but I definitely know that if you're immunocompromised, they don't recommend you getting a live virus or this virus at all. So as far as immunocompromised patients, they're not recommending that they get the vaccine.
Okay, all right. Question comes back. Moderna has more side effects. Do you guys trust one over the other? Moderna has more side effects. Is one preferred more than the other? Is there a preference among you?
Evidently, that's a hard one to answer.
Evidently.
But again, these vaccines are going through a great deal of scrutiny by the FDA. They did not relax any of their guidelines or recommendations or requirements, rather, for vaccination. So if it's been approved and it's out on the market, some of the side effects that are going to be very short-term, maybe 24 hours in, but it's still not the same as getting the virus. Okay. So I would say I wouldn't make that stop me from getting either one of them.
All right. When is the Johnson & Johnson vaccine projected to be available? The Johnson & Johnson vaccine? No? Anybody know? Jean, anyone?
I was going to ask Crystal. She might have more intel. My understanding is they're in phase 2. And usually phase 3 trials is where they vaccinate a larger proportion. So that tends to be a longer period of time. I can't imagine it would be ready in the next couple months.
Yeah, as of yesterday, I think they said that they were reporting to share the results of the next phase of the trials, I think by next week.
Okay, all right.
And that's a 1 dose. Johnson & Johnson will be a 1 dose vaccine.
Okay, 1 dose.
Yes.
Okay.
Mhm.
All right. If a person has several diseases and are allergic to several different types of medications, how do you advise them to proceed?
They should work with their primary care physician before they get the vaccine. Even just anecdotally, some friends of mine who have allergies, their physician is recommending that they wait to get the vaccine in their office, so then their physician can monitor any severe reactions, even though severe reactions are very rare. But that's why after you get the vaccine, we have a waiting area at the health department, and every vaccine clinic is doing this as well, to be observed for 15 minutes. We have medical staff on site as well as EMT available if you happen to have a very rare severe reaction.
All right, we want to emphasize that very, very rare. All right.
And very rare is defined as, not being able to breathe, like anaphylactic shock. So that's, a very extreme reaction.
Okay. All right. Very good. Next question is, I understand the vaccine is free, but I have serious side effects. But if I have serious side effects, will that be fully covered by my insurance? And I think, Crystal, you did some research on that question.
We've gotten this question a lot, especially with our health equity office. So the vaccine is completely free. From a side effect perspective, it should be covered, but from the hospital's perspective, if you cannot pay, then the hospitals and the health department can help support you get through that. But hopefully, you will not have any side effects that require any hospitalization. Most of any of the side effects just are gone within 24 hours.
All right. Good news. All right. So how are we looking on time here? Oh, okay. So we got about 5 more minutes here. Let's talk about the vaccine distribution. If we can get some information out to our listeners. Would you mind running through the phases for the distribution, like who is in 1A, 1B, 1C? I don't know, Crystal, you have any?
Sure, I'd be happy to share.
Share something up on that for us. 1A.
I can. Let me show you a little visual. So right now we are currently right at the beginning of phase 1B. So I know it seemed a little concerning. Let me make sure I'm sharing the right screen. Yes. When there was announcements about everyone going into 1C, but we actually are just in 1B. So right now we are currently only vaccinating adults 75 and older. That is the only part we are at 1B. So if you feel like you're in, I think I'm in 1C, no one has been skipped. We are just at the beginning of that. And that's mostly because of limited vaccine availability. So we may be getting even less than 5,000 shots a week, and we don't always know how much we're going to get for the next week until days before. So like this Saturday is when we found out how many vaccines we were getting for the next week, for example. So please bear with us as we work with the state and the federal government to make sure that we get more allotments. We're working to get more of that. So our next big group will be educators and our childcare workers for our next phase. And we're going to be working with our fire department to help get our educators vaccinated. Can you go back to that screen? That's the 1C for the education for teachers? No, educators are 1B.
Oh, 1B, I see.
Mm-hmm.
Ask me, where's clergy?
That's a great question. So I would imagine they'll be in 1C, more than 1C or 2. So some of our clergy members are falling between that frontline or essential workers.
Yeah, I think we are essential workers.
I agree. Mm-hmm.
All right. What was the other screen that you had?
It's just a breakdown of the different groups. So,
Okay,
and the way Dr. Hogan phased it is like Southwest Airlines. So even though we're moving to new phases, we're not done with phases. We have not finished vaccinating all the healthcare workers. We're just adding into those groups to start getting those priority groups vaccinated.
all right. So, okay, that's good you have that so we can see the time frame. So
Mhm.
January, March, we in 1B. So the state has us showing in 1C, but Anne Arundel County is showing 1B, indicating 1B.
Yes.
Okay, just because that's where we are as far as availability of vaccine.
Yeah, that's a huge factor. Yes. If we open up to the next phases with that many thousands of people, we do not have enough vaccine to even accommodate. We're still working on getting these groups now. So,
All right.
and yes,
Yeah.
and so then we'll keep moving on. So then hopefully we'll be in phase 1C by late February, March, and then reaching those frontline essential workers by March and April. And then April, May will be phase 2 with the essential workers. And then phase 3 will be the general public.
Okay. All right. Okay. So hopefully we're all going to be vaccinated by the summer.
No.
No.
No. Unfortunately, I wish that was the case. We don't have enough vaccine, even doing 10,000 a day. I mean, we have a large population to get through all those groups to even reach the herd immunity, which is the 60-70% of our population. So this is
So
going to be a marathon.
so with the ramping up that the Biden administration is planning to do, so you're saying even with that, it's not going to get us to where we need to get to by summer?
We're in this for the long, because even just logistically getting the vaccines into everyone's arms, the registration, and it's quite a process. It's going to be a little bit of time, but we're asking people just to be patient and to pre-register if they can, so they can get that notification as soon as they're qualified to get the vaccine, and also to respect the honor system. So if you are not in that phase yet, please wait to take the vaccine out of the arm of a 75-year-old, because I mean, we understand that you're scared, and we love that you're ready to get it. But think of it as taking it away of your grandmother. That's what you're doing if you jump the line or use a registration link from someone else. So we're asking kindly that everyone please just wait your turn. We promise it is coming, and to continue wearing your mask even after you get your vaccine.
All right.
So
Correct.
Pastor K, I wanted to ask Crystal, what are we doing to help some of those who are not computer savvy, don't have computer access? How can they get help?
Great question. So we're working with the Department of Aging to help people register via phone, and I'll put that phone number on the Facebook page if that will be helpful. So we are working with the groups there to try to do some outreach, and we're even thinking of how we can go out to the communities to help people get registered. And eventually, as more vaccine becomes available, we are going to leverage our Wellmobile to help go out to the communities and help people get vaccinated as we get more vaccine. But that's all on the horizon. But we do have that phone line now for those who are wanting to get registered or make an appointment for the vaccine.
So how soon do you think we'll be able to go to Walgreens and CVS to get my shot like I do with the flu vaccine?
That's a great question. I hope that will happen by the summer. That's what I hope. That's what we're all hoping for. By the summer, by that May, June timeline, we hope that Mr. Biden could
put that
come through with us. Yes.
So here's the other question too. So in Baltimore, they have it set up at the stadium where we're going to be able to do the mass vaccination, and over here in Prince George's County. So how does that work? I can see for the first vaccination, how does that work for the second one? I mean, is somebody tracking that? How does that work?
Yes, it is tracked. So the complicated part is that there's more than one registration system in the county and in the state. So you can register through a hospital, you can register register through some of our partners. You can register through the Department of Health. It is very important that when you go to get your second shot, you get your second shot through the same place you got your first shot, your booster shot. That is very, very important. Because we are tracking that. So with the Department of Health, we're using a system called PrepMod. You'll see that when you register, PrepMod. And they'll send a notification specifically to you for your registration for your second dose.
Okay.
That's a good question.
Okay. This is 3 more questions here. Okay. So this is back. I say, is it possible to get the virus even after the vaccine, but you don't get sick? Can I get the vaccine and still get the virus, but don't get sick?
What I can say, it takes about 2 weeks from the time you receive your vaccine for your body to build the immunity. And understand that even after that first shot, you do have some level of immunity, but you don't have that 95% immunity. So with the second shot, just remember, it will take 2 weeks for your body to lock in that 95%. What's important here is, and the reason the CDC is recommending that you still maintain your masking, your hand hygiene, your disinfection, your distance, is one, everybody's going to be different and their immune systems are different. There is good response and evidence to show that regardless of age, gender, and ethnicity, that the achievement of that 95% protection is there. However, we can't account for those who are that 5%. And also, until enough people are vaccinated, you don't want to go into a situation because you can still pick the virus up with your hands, transmit it back to your home environment, things along those lines. So you yourself may not get sick. However, the people that you may interact with, you may have the ability to, transmit it depending if you're not following those recommended guidance. So until we reach that herd immunity, that's another reason why they still want us to maintain those precautions.
Okay. Can the vaccine be mixed? Like, can you get a Pfizer and then another brand? Okay. I see heads shaking.
No, the vaccine should not be mixed.
Okay. So
think of it like a puzzle piece. So your puzzle will not be complete unless you get the matching piece to go with it.
Oh, that's a good analogy. So the doctor's office is going only have one brand.
They may get more than one brand. So, but that patient needs to only get that same booster shot to match.
So they just need to make sure when we go in, we need to make sure, okay, I got Pfizer the first time. I need to make sure you put the Pfizer in his arm the second time.
Correct. So when you get your vaccine, you will get a card that shows what vaccine you got. And I will say, I've even noticed with some grandparents, they may not have realized that there was a specific brand. So if we can support our community members with that and say, hey, which one did you get, to help them kind of keep on track.
Okay. Very good. All right, good. And this was the last question. It is, who is considered immune compromised? Is that a cancer patient? Who falls into that category? Who are the immune compromised? Who are considered to be immune compromised?
The several patients that's immunocompromised, such as HIV patients that's diabetics, patients that take prednisone, they can be immunocompromised as well.
Okay. All right. Great. All right. So that was, I think that's all of the questions that have come from, oh, wait a minute, there's one more.
For people that work, maybe say with residential apartments, where would they fall?
Repeat that again.
Like if a person worked through a residential apartment, where would they fall?
Okay, so the question was, if a person works, I guess, like a manager,
or us regular people, do we go based on time?
as a person who's maybe working as a residential apartment, working in a residential apartment, where do they fall in the 1A, 1B, 1C? Is that the question?
If they're working in a residential apartment, their first factor that's going to sort them is their age. So if
Okay.
they're over 75, then they're now, right?
Mhm.
But then if they're younger than that and they have an underlying condition, and I put the link in our chat, we can share it on Facebook as well for what the CDC defines as high risk conditions, then you're going to be at a 1C. But if you are below the age of 65 and you don't have any underlying conditions, then you will be phase 3 with the general public.
All right, good. All right, so this question is for Anne Marie, for Curta, and Irma. If you can unmute yourselves. When do you think First Christian will be back in session?
I hope sooner than later.
To Irma now.
As soon as we can behave ourselves and do what we're supposed to do. And I mean, it's a large church. As long as we can, when we know how to come in, go to your corner, sit in your seat, don't hug your neighbor, and go home. That's my thought.
I was hoping we have service outside this summer.
Oh, we did that. We did do it one Sunday. Yeah, it was hot out there.
Hot? Okay.
It was hot.
Okay. I figured that would be an issue. Okay.
Just one other clarification.
Okay. Oh, wait a minute. We got a question for clarifications.
They're saying, are you saying that if you have cancer or HIV, you can't get the shot? I don't think they were clear.
No. Please clarify those who immunocompromised. Someone was confused. They're saying, are we saying if you're immunocompromised? I want to make sure I'm pronouncing that right. Immunocompromised, is that correct?
Yeah, that's good.
Should you get the vaccine or you shouldn't get the vaccine? They want clarification.
If it was a live vaccine, they would highly recommend that you not get it. But I know that some patients that are immunocompromised, their doctor is definitely still saying no because of the evidence and the information that we have on the vaccine. So I know one patient that I spoke with, she said her doctor told her that she should not get it based on the evidence and stuff from the vaccine.
All right.
But
good.
I think
So they need to talk to their doctor.
Yeah, I think you should consult your doctor whether you qualify to get it.
All right. All right, listener, I hope you've heard that. Consult your physician as to what you should be doing. All right. Great. Okay, so final words, ladies. The drive home message that I'd like for each one of you to share. What's your drive home message about this vaccine, especially about the African American community? What is it that you want to drive home tonight? Crystal, I'm gonna start with you because you look ready.
I'm ready. My first important takeaway is that it's okay to be hesitant. Your feelings are valid. I mean, that's very important. Like, we have a lot of history with this, as Dr. Johnson mentioned. That's okay. The important part of attending these panel discussions, you're doing the right thing because you are doing the work to get informed to make the best decision for you and your family. So that's the most important thing. And then just to reiterate, and I saw another doctor say this on another panel, which was wash up, mask up, separate, and vaccinate. So if you only feel comfortable with 3 out of 4, that's okay. But just that's our big takeaway now is to still keep doing those things.
Yeah, great. Jean?
My takeaway would be is we have to use all the tools in the toolbox. Even, vaccination plays a huge role in this. And the goal of vaccines is prevention. And so we would rather catch it early and prevent it than having to work and use other tools, but you're already in that critical phase of being infected. So prevention is key, and it aligns very well with other prevention measures like our masking, as Crystal had mentioned.
All right, great. Anne Marie?
My philosophy has always been to be proactive, like Jean says, and not reactive. So for the most part, just like Crystal and everybody has said, if we continue to wear our mask, wash our hands, and distance continuously, get the vaccine. I think everybody needs to do their own research. I believe in listening to other people, but this is a decision that you need to, if you need to consult your physician, you know, everybody who attended this panel, hopefully it was helpful, and you just need to make the decision and make it based off of evidence, not, you know, because somebody else said or what happened to somebody else, because, you know, we're all different and we're all gonna, if you're gonna have a reaction, you know, prayerfully it's going to be mild. So just make, because I'd much rather have, somebody said, I think, Jean, it was in one of the chats that we had at work. Somebody said, if you weigh COVID, or, you know, we've seen thousands of people who have actually died from COVID, but the number, I haven't heard of anybody, or maybe one person maybe have died, but they can't even say it's from the vaccine. So if you kind of look at those numbers, you know, you can make that decision on your own.
Okay, all right, for Curtis.
Thank you again for allowing me to be on the panel. My takeaway would be that you do what's best for you and your family. I also think that you should consult with your doctor so you can get some information and decide what's best for you guys. And far as the I think you should definitely vaccinate, wash your hands, stay masked up, and definitely, you know, stay separate, 6 feet away from each other. But
All right.
you know,
That's staying away from each other. That's where our folks struggle.
it's hard.
Irma.
Well, I just want to say we're all in this together. It's a community thing. When they talk about herd immunity, the community is the herd. So I'm really hoping that people will really make an informed decision on their way to getting vaccinated. So that we can get out of the mask. And I'm not as optimistic as Pakurta, thinking it may be September. I'm probably more down in December, but I am optimistic that we can get on the other side of it if we get vaccinated, like we've had different vaccines. You know, we defeated polio the same way. So let's get vaccinated and defeat this thing is what I have to say.
That's good. Yeah, we do need to do what we need to do to pull together. And really, again, this is truly a battle. And it's only going to be won if we are cooperative and do what we need to do. And it requires a lot of sacrificing. I just want to address, so to my FC3 family, some of you are wondering, the question came in, you haven't let us back into church to see if we would behave. And you're right. We didn't. And that's because we really wanted to exercise extra caution. And I have to be honest with you, I'm glad that we did go to the extent that we did, because a number of our partners did become infected. And had we been in congregation, who knows whether or not that could have turned into a super spreading event. So yeah, we did err on the side of caution. And we will continue to do so. We have not necessarily followed the phases of the state or the county, because even now we can still have a certain number in. And due to the size of First Christian, that number can be still relatively large for us. But we just wanted to be careful, especially once we get out. And I want to tell you the other thing. See, can I get for real? The for real is, I see y'all out on social media socializing with no mask, hanging out, doing what you want to do, and then you won't come to church and bring your virus. That's not gonna happen. Can the church say amen?
Amen.
All right, good folks. Well, thank you again, panelists, for joining us tonight. I really appreciate it. I hope our listeners got the information they need so they can make a good decision regarding their health as they go forward. And again, we want to thank you, Crystal, from The health department, thank you for being here. Thank you, Jean, for all the information that you have given to us. And for Curta, thank you, and Anne Marie and Irma. As always, you guys work so diligently in our congregation, keeping all of us healthy and keeping us informed. And so we really do appreciate it. So thank you again. Thank you everyone for joining us tonight. I'm going to ask our panelists if you just will stay on board once we go off live. But again, thank you. Thank you, FC3. Thank you, Annapolis community, for joining us tonight. God bless you and take care.